Before starting the Bob Interactive method, I show my patient his previous Bob score. I also show his past scores and his previous mouth map to give a reminder on what aids were recommended and what sites were inflamed. We then start a new Bob score. Starting on the upper right sextant, I begin to complete an intraoral examination. This is to check if there are any additions or changes with regards to missing teeth, crowns or implants. Moving from sextant to sextant, I can see that no changes have been made, so I simply swipe along until I start the Bob score. As I have completed a Bob score on Edward before, I can view the colour of the previous interdental brushes by the colour of the circle adjacent to each interdental space on the chart. My patient is also able to view his assessment by the mirror in front of him. This is part of the Bob Interactive method, and today we complete this by using the IDB only method with OHI simultaneously. I begin with the pink prime interdental brush and check if this brush is still appropriate to use in this area. Edward then interacts with the tablet and clicks the pink prime button. In the upper right sextant, I recommend a single tufted brush, as Edward has a large interdental space here. I demonstrate and remind Edward how to use this aid in that area. He then clicks the Others button to input this aid into the Bob score. I continue with the pink prime brush, as this is the brush from the last session. However, today it is now possible and appropriate to increase this brush size in this area to that of the yellow prime. Edward inputs his new colour into his score and the bleeding sites present. A notification also reminds me that I have now input 3 or more aids and questions, is my patient confident and competent to use this quantity. We continue on to the upper anterior sextant, where previously Edward was recommended the prime turquoise. I check the size whilst Edward is watching the technique I use for this brush in this area. He then inputs into his score the turquoise brush for the upper anterior sextant. He holds down the button which automatically infills the whole sextant with that colour brush. However, we need to change one area to the pink prime brush, as it is now possible to use this brush in that area. Edward inputs this information along with the bleeding present. We continue on to the upper left sextant with Edward watching the technique demonstrated. I then return to show him the bleeding present after removing the interdental brushes. He then inputs his interdental brush size into his score. Once completing the lower left sextant, it is clear to see that Edward has no inflammation present today. A great comparison to see from the bleeding spots that is present from the last session. The lower anterior teeth show turquoise and bleeding sites from the previous session, and although the brush size has not changed today, what has is that there is no bleeding present. We finish on the last sextant, that being the lower right. I used the pink prime brush as this was the brush colour indicated from the last score. However, today it is possible to increase the size to the yellow prime brush. The Bob Interactive Assessment is complete, and it is now time for the review and coach before the patient receives his Bob score.